The sole purpose of this channel is to bring to light events and situations that the Trump administration is responsible for, either directly or indirectly. It is our viewpoint that Trump and his cronies have done more damage, either directly or indirectly, to this country than any other president in the history of the United States, and that he must be stopped. To that end, we hope you will support this channel and help us see this tyrant removed from office. USA disgrace. Amy McGrath, a retired U.S. Marine Corps Lieutenant Colonel, who was raised in Kentucky, is running for the U.S. Senate to fix Washington, and give Kentuckians their voice back. Check out our other videos on Mitch McConnell and his misdeeds, if you're not already familiar with them, and it's easy to see why we need a change. USA disgrace. The following is from her website, https://amymcgrath.com. Amy was born the youngest of 3 children to Donald and Mary Ann McGrath, and grew up in Edgewood, Kentucky. Amy's father was a high school English teacher, and her mother was a pediatrician and psychiatrist, and was one of the first women to graduate from the University of Kentucky Medical School. When Amy was 13 years old, she dreamed of becoming a fighter pilot, but women were not yet allowed to serve in combat roles in our military. Determined to find a solution, she wrote her elected officials to ask them to change the law. She never heard back from her senator, Mitch McConnell. After the law was finally changed, Amy attended the U.S. Naval Academy and was commissioned as a Marine Corps officer in 1997. She went on to serve 20 years in the Marines. First, she became an F/A-18 Weapons Systems Officer, backseater. During this tour, she completed 2 combat deployments, and flew 89 combat missions in Iraq and Afghanistan, targeting Al-Qaeda and the Taliban. In 2002, as a Weapons Systems Officer, Amy became the first woman in the Marine Corps to fly a combat mission in an F/A-18. In 2004, she transitioned to become an F/A-18 pilot and completed a second operational tour deploying to Japan and flying all around the Pacific. She completed her 3rd combat deployment in Helmand Province, Afghanistan in 2010. After serving 20 years in the Marines, Amy moved back home to Kentucky to raise her family. After her operational flying tours, Amy served as a congressional fellow advising a senior member of the U.S. House of Representatives Armed Services Committee on Defense and Foreign Policy. Subsequently, she served in the Pentagon as Marine Corps liaison to the State Department and other federal agencies. She earned a master's degree in global security from Johns Hopkins University, and she is a graduate of the Center for the Study of Weapons of Mass Destruction's program for emerging leaders at the National Defense University. Her final assignment was as a senior instructor in the Political Science Department at the U.S. Naval Academy before retiring at the rank of Lieutenant Colonel and moving back home to Kentucky to raise her family. Her awards include 2 Meritorious Service Medals, 8 Strike Flight Air Medals, Navy, Marine Corps Commendation Medal, Navy Achievement Medal, Presidential Unit Citation, and Iraqi and Afghan, 2 Campaign Medals. Amy lives in Georgetown, Kentucky, with her husband Eric, a retired Navy pilot, and her 3 children, Teddy, 7, George, 5, and Eleanor, 3. I believe health care should be affordable and accessible to all Americans. In the same way that basic education is the foundation of a strong country, health care affects our nation's competitiveness and security. As the mother of 3 young kids, a Catholic, and the daughter of one of the first women to graduate from the University of Kentucky Medical School, it's a deeply moral issue for me. Kentuckians need affordable health care coverage they can rely on. Stop undermining the Affordable Care Act. Too many people have been priced out of health care while Washington politicians like Senator Mitch McConnell fail to fix what is broken with our health care system and actively undermine what protections we have. The Affordable Care Act, ACA, is far from perfect, but through Kinect and expanded Medicaid, it enabled many Kentuckians, especially those with pre-existing conditions, to get affordable health insurance for the first time. As a result of the ACA, the uninsured rate in Kentucky dropped to 11% from 20%. But Senator McConnell still pushed to pass a repeal bill without replacement legislation that would have stripped health care coverage from up to 23 million people. And he did this all while taking in nearly $2.5 million in donations from the insurance industry over his career. Overwhelmingly, doctors, nurses and health care organizations in America have opposed Senator McConnell's efforts to repeal the ACA without a replacement. I remain committed to working for a bipartisan plan to fix the ACA's problems, while maintaining current essential health benefits, preventing insurers from charging higher premiums based on factors such as health status or pre-existing conditions, and without imposing annual or lifetime coverage caps. Bipartisan solutions for America's health care. We have to be honest that the ACA falls short of where America's health care system should be. My mother was a practicing doctor for 40 years and I saw her frustration with the power of insurance companies and with the associated rising costs. We can do better in this country, and we must. I firmly believe that the goal must be universal coverage for all Americans, but we need to be honest about how to get there. A single-payer system would require such a sweeping overhaul of our health care system that it would throw our system into massive upheaval. Since we are not starting from scratch and we have to work with the system that we have, I do not currently support such an approach. Every major piece of legislation in our country has needed fixes along the way. Social Security and Medicare were not created perfect. And as we have fixed and revised these programs so necessary to our American way of life, we have also expanded opportunities and overcome challenges in every generation. In each case, we didn't quit simply because it was hard and the answers weren't clear at the start. Instead, we redoubled our efforts, worked together, and found ways around obstacles. That is the American way. We work overtime, in the words of the Constitution itself, to make our policies more perfect. We must address rising premiums and deductibles, and the rising cost of prescription medications without limiting access to affordable health care. This is critical, and there are some realistic ways we can do that. Public option. A public option would give all Americans the opportunity to buy a publicly run insurance plan instead of a private insurance plan, if they prefer to do so. With some people still unable to afford coverage and many more paying too much for the coverage they have, we must increase competition among existing carriers. A public option would lower premiums, since the goal would not be to make a profit, and would guarantee that in those counties with just one or two insurers, rates would not artificially spike with a lack of competition. This also gives people more choices. No one would be forced to go with a government-run plan, but it would be there if Americans wished to choose it. Medicare buy-in. I support a Medicare buy-in option for those over the age of 55. This would provide some peace of mind for more vulnerable Americans who have some of the greatest health care needs while lowering premiums for those under 55. Lower prescription drug costs. The average Kentuckian spends over $2,000 annually on prescription medications, the second highest in the nation. Senator McConnell has a long history of repeatedly blocking solutions that would address this problem, including legislation that would have allowed Medicare to negotiate lower drug prices. While blocking this legislation, Senator McConnell has taken in more than $1.5 million in campaign cash during his career from Big Pharma and was the #1 recipient of Big Pharma cash in his last election. I will not be bought off by Big Pharma. I will work to rein in prescription drug costs for my fellow Kentuckians by taking on the pharmaceutical industry, exploring new options like re-importation, and allowing Medicare to negotiate lower drug prices. Opioid crisis. Our friends, family and community members are dying at alarming rates across the nation from the opioid crisis. From 2014 to 2017, over 230,000 people died from a drug overdose in the U.S. By comparison, we lost 58,000 soldiers in the Vietnam War. This is a public health crisis and a huge national problem that needs a multi-level response. Lawmakers need to start being honest about investments that will be needed to tackle this drug crisis in areas of research, prevention, treatment, and recovery. Most experts say we need to invest approximately $60 billion over 10 years to actually improve outcomes. Senator McConnell has only secured a fraction of the amount needed. He is throwing pennies at a major epidemic and giving us lip service from Washington. Along with being a public health and moral issue, this is a workforce issue. Individuals who are struggling with addiction could be working to support their families and communities. They need help. A 2017 report by the Kentucky Chamber of Commerce found that the state's high rate of opioid prescriptions drives Kentucky's low workforce participation rate and makes it harder for employers to fill available jobs. Substance abuse also drives chronic homelessness. We need to scale successful programs like Recovery Kentucky, a program that provides housing and addiction support services, to the national level. These programs save the state's taxpayers millions of dollars in emergency room bills and jail costs. The federal government ought to be supporting similar programs as part of a comprehensive declaration of emergency to fight the opioid epidemic. We also need to expand funding for health and human services to expand research for better treatments. The time to act is now before we lose more lives to this disease. I will work to make sure Congress starts making real investments at the federal and state level to end this crisis. Senator Mitch McConnell, who has been in office 35 years and has the seniority to address these problems, doesn't have the answers. Despite his role as majority leader, much of the Kentucky economy, and the infrastructure it depends on, has long been ignored. We have a senator who says no to everything Kentuckians need. Senator McConnell voted against raising the minimum wage at least 16 times while voting to raise his own taxpayer-funded salary 6 times. To top it off, he passed a tax bill that featured massive giveaways to the wealthy and large corporations, giveaways that will increase taxes on 53% of Americans by 2027, according to the Tax Policy Center. That is inexcusable. Here in Kentucky, we need empathic, clear-eyed leaders who are willing to make the hard choices to better serve the great people of this state, people known for their hard work, their energy, and their drive. We need leaders who know how to say yes to making Kentucky strong for all Kentuckians, not just the rich and powerful. We need leaders who say yes to raising the minimum wage, yes to investing in underserved communities, and yes to funding for badly needed infrastructure improvements. I will be that kind of senator. We hope you enjoyed this video and that you appreciate our efforts to stop Trump and his cronies before they do any more damage. Please don't forget to click subscribe, hit the golden bell icon, and make sure you have notifications enabled on your account. To enable notifications, simply search "How to enable notifications" on my YouTube account. Usadisgrace.